The Scaling Up project is a project which is funded by the Health Foundation, and the aim of that is to collaborate with 5 other trusts. One of the key components of our improvement has been using the National Hip Fracture Database, which is a national audit which is run by the Royal College of Physicians. The important part of that is that they were able to give us feedback about our performance compared to other trusts, and it was that we used as the basis for our improvement in the early years with HIP QIP. So in terms of where we're at now is that we're really in the middle part of our project with the various learning events going on, and this is where we bring all the groups together, maybe 5 or 6 people from each collaborative, maybe more, all meeting at one site where we discuss how to improve together.
So within the project we're working with 5 other NHS organisations which are based in Glasgow, Weston-super-Mare, Gloucestershire, South Tees and Greater Glasgow. The overall ambition for the project is to save 100 lives across our organisations that we're working with, but also to spread our good work. There are lots of different factors and things that we're implementing as part of the project, but one of the things that we know has a significant impact on mortality is additional nutrition. The team at Northumbria Healthcare have been supporting the introduction of the nutritional assistants and sharing ideas across the different organisations.
Patient Leader programme involves currently 5 patient leaders in Northumbria, and we all have different roles. So my interest has been end-of-life care and pain management. There are other arms of the Patient Leader programme, things like nutrition, things like communication and information. When you're trying to improve a service, it's really important to bring people that have used that service into it. If I can be part of that team that saves lives, that's going to be a very proud moment for me.
So the whole project is evaluated in 2 ways. One is on the outcomes, and that essentially is the data that we produce, so that will be based on things like mortality. In terms of the process of improvement, so how we've improved across the collaborative, that's independently evaluated by Dr. Wyn Tad, who really has a very excellent skill in working out how teams are improving or indeed how they're not.
Within Northumbria Healthcare, we've been measuring patient experience for a number of years, and we recognise the value of that in terms of providing and enhancing the best care possible for patients.
We are working with our partners, the British Orthopaedic Association, to spread these good ideas. So once we've learned exactly how to improve at scale based on these 6 trusts, we will then be spreading it beyond this local group of 6.
So the exciting thing is that already we're being approached by other organisations that aren't involved within our collaborative, and we've been sharing information with them, and it's already generated a lot of interest, which looks